This video provides information from the internet, and we do not promote any products or medicines. Always consult a doctor before using any medication. We are not responsible for any side effects or issues resulting from self-medication.
Apigat 2.5mg tablet is an anticoagulant that helps manage blood clot formation. It is effective for various conditions and is crucial for patient safety. Indications and uses. This medication is indicated for managing blood clots formed in the veins of the legs, particularly in patients with irregular heartbeat, and to prevent clot formation after hip or knee replacements. It is also effective in reducing the risk of recurrent blood clots in the legs or lungs, providing essential care for patients at risk. How it works. The medication functions by inhibiting clotting factor XA, a key component in the body's blood clotting process, thereby preventing the formation of unwanted clots. Directions for use. Take the medication as directed by your physician, swallowing it with a full glass of water. If swallowing is difficult, discuss alternative methods of administration with your doctor. The appropriate dosage and treatment duration will depend on various factors such as age, weight, and specific health conditions. Possible side effects. Common side effects may include bleeding from various body parts, bruising, anemia, and low blood pressure. If these symptoms arise or worsen, it is essential to seek medical advice promptly. Precautions and warnings. Patients should exercise caution when taking this medication, especially those with liver disease, kidney problems, or a history of bleeding disorders. It is not recommended for pregnant or breastfeeding women, and elderly patients should use it under medical supervision. FAQs. 1. Is this a blood thinner? Yes, it is an anticoagulant. 2. What precautions should I take? Inform your doctor about any pre-existing conditions. 3. What if I forget a dose? Take it as soon as you remember. 4. Can it cause low blood pressure? Yes, it can. Consult your doctor if this occurs. 5. Is it safe during pregnancy? No, it is not recommended during pregnancy. Thank you for watching this video. If you have any questions or suggestions, please leave a comment below. Your health matters to us.